consultant diabetologist in Bijapur. I am practicing since many years as a diabetologist. Today I am speaking about diabetes and hypertension. So there are many conditions where I can speak about, but today's topic is only diabetes and hypertension. It is for the sake of the people, normal, common people who can understand why diabetes is happening, why hypertension is there. First of all, what is diabetes? Let me tell you. Diabetes is nothing but it's a metabolic disorder of the body wherein insulin production has been reduced. So when insulin production is produced in the body from pancreas, whenever there is insulin production has been reduced, sugar level jumps up in the blood. So that is diabetes. So what is normal level of sugar level? Whenever you see the patient 120, 130, it is postprandial. Fasting will be around 80 and 90. This is normal blood sugar level. Whenever a blood sugar level goes up 180, 190, 200, we call it as pre-diabetic. More than 200, 220, it is called as diabetes. So in India, there are a lot of people who are pre-diabetic and diabetic. So they are still compared to Western countries, India, we are seeing there are a young number of people who are suffering from pre-diabetic and diabetic, they have not been detected. Why? Because our concern is people are not going to hospital, not getting detected by themselves because of their family status or the economic status. So these are the condition, and even high investigation value of cost. So these are the people, and education is also one of the reasons why people are not getting investigated. And because of this, compared to Western countries, India is lagging behind, and we have a lot of diabetic and diabetic people. So what happens due to this? When we are not being detected with either diabetics or pre-diabetics, people will fall into cardiac arrest. Other complications are there due to diabetes, where people suffer from sudden cardiac arrest, paralysis. So these are the things which they suffer from diabetes. So and hypertension as well. So what I want to tell, why this diabetes is happening nowadays more is because of sedentary lifestyle. What is sedentary lifestyle? Lifestyle is people not working too much, just sitting on the chair, more of software engineers. Usually it is found in urban areas where people are having a sitting lifestyle and more of junk food they are eating. Because of junk food, obesity, body fat is increasing. Obesity is one of the conditions where diabetes is also there, where is concomitantly there is hypertension as well. Hypertension I am going to speak now in future, furthermore when I am speaking and regarding hypertension. I just speak about diabetes, why it is happening. First I have told you about the then I told about obesity. So second, third thing is people are having lot of people are boozing a lot. They are taking a lot of alcohol. Alcohol in small quantity, it is okay. Wine is okay, but they are taking a lot of alcohol. Lot of alcohol intake is the one of the condition for that. And one more condition is nicotine. People are taking a lot of nicotine, that is gutkhas and all. India is having a lot of people who are taking gutkhas, and there's a lot of smoking is going on. So these are the people which the diabetes and hypertension is increasing nowadays in the people of, especially in Asian countries, this side. So what I want to tell you is this comorbid condition due to diabetes, what are happening is ischemic heart disease is the most common nowadays. Heart attacks happening more after COVID. We are seeing a lot of people dying due to heart attack. Then second is people are suffering from hypertension. People are suffering due to diabetes. So these are the complications after COVID, and because of this, they are suffering from hypertension, diabetes, and obesity. So third thing I want to tell regarding diabetes, what are the complications? I told you the heart attack and all. So people, whenever you are suffering from diabetes, I advise you to go to dietitian or any physician or any endocrinologist to check your every month what you have to, at least to keep the tight control of sugar, so that it should not they should not have a complications of diabetes. So whenever you check, you fall in for diabetes, you every 3 months you check A1C, HbA1c is must, and every 6 months you go on checking for lipid profile, kidney function test, and liver function test. See, I don't want to speak about liver and kidney now. I want to tell, as I told you, I am going to speak about diabetes and lipid. So what lipid profile, why you have to check is, at least you check total lipid profile with total cholesterol, LDL, HDL, and triglycerides. Usually in diabetes, whenever the sugar level is not under control, you will see triglycerides is higher side, LDL is higher side, total control cholesterol is also higher side. So once you control this sugar level, definitely cholesterol, that total cholesterol will come down, triglyceride, LDL, all these parameters will come down, due to which there will be no heart attacks in future. So apart from this, what you do is 5 kilometers walking is necessary for nowadays for the people who are having sedentary lifestyle, so that you will not fall into for diabetes and hypertension. So because of that, you will not go for heart attacks, paralysis, and sexual dysfunction. I am seeing a lot of people who are suffering from sexual dysfunction at younger age, 30, 35, 40 years, because of diabetes and because of hypertension. So what I take home, my message is, please go for walking, stop alcohol, stop taking nicotine, go for walking, and stop junk foods. So all these things, and apart from that, go to the particular doctors for treatment to get tight control of sugar and tight control of total cholesterol. That is lipid profile. What I am telling is lipid is totally I am telling. So that is the total cholesterol, LDL, HDL, triglycerides. So all these things parameters of tight control, so that nowadays you are seeing a lot of people dying due to heart attacks. So please see that all these parameters you get checked every 3 months, 6 months, so that you be healthy, safe, and always life will be very good till you die. So my particular advice is, check your all body parameters nowadays. And one advice I want to give nowadays is, at least you take one cholesterol, whenever increase you get lot of lipid lowering agents. Along with that, you take aspirin 150 mg daily, so that you will not fall prey for heart attacks. So 150 aspirin daily, who are suffering from diabetic and hypertension, please take aspirin 150.